Today, we're talking about how omega-3s may help with dry eye disease. Watery, irritated, and gritty eyes, known as dry eye disease, is a disease that's characterized by an irregular layer of tears on the front of the eyes and inflammation. If we can get the tears back to homeostasis, back to normal, then we've addressed the underlying issue. I want to share a study with you that's called a randomized, double-masked, placebo-controlled clinical trial of 2 forms of omega-3 supplements for treating dry eye disease. It's not a very catchy name, but this study was to assess the efficacy of 2 different forms of omega-3s in treating dry eye disease. Krill oil, which is a phospholipid type of an omega-3, compared with fish oil, which is a triglyceride form of an omega-3. The phospholipid or krill oil is thought to absorb more readily into the body. It also has an antioxidant in it, astaxanthin, which is, well, anti-inflammatory as well. Here are some of the details of that study. The study participants had mild or moderate dry eye disease. The study lasted for 90 days, and participants were given either a placebo, krill oil, or fish oil supplements. And here's what they found out. They measured tear osmolarity, and both krill oil and fish oil supplements reduced the tear osmolarity compared to the placebo. Now, having a reduced tear osmolarity is just having your tears a little bit more similar to how they should be. When we have evaporative dry eye disease, where the tears evaporate too quickly, we end up with too many particles in the tear film. And that's what osmolarity is, the measure of how many particles are in a liquid. And so reducing that tear osmolarity indicated that there was less evaporative dry eye disease. They also looked at symptoms. The Ocular Surface Disease Index, or OSDI, and for this score it measured that dry eye disease symptoms were significantly reduced in the omega-3 groups. They had 2 different ways to look at the clinical symptoms. There was the tear breakup time and the bulbar redness score. For the tear breakup time, they were looking at how long it takes for the tears to evaporate off the front of the eye. In the office, we can put a little dye in the tear film and we can look at the eyes and have you blink a few times and then hold the eyes open. As we watch your eyes, we can time how long until the tears start to evaporate. We also have some different equipment that can do that very precisely and get down to how many milliseconds until the tears start to break up and where the tears start to evaporate first. So in this study, they did a tear breakup time measurement. It's important because between blinks, we don't want the tears to start to evaporate, or else we'll start to have chronic damage and inflammation on the front of the eyes. They found that when they looked at the tear breakup time, as you can see in this graph, it was significantly improved in the omega-3 groups. Not surprisingly, if you look at the redness graph, there was less redness as well. And that kind of makes sense. When there's damage in the body needs to repair it, and so it does what it always does. It sends all of its little workers, all the blood over there to try to fix the damage. Because we're looking at the conjunctiva and some clear layers of tissue there, we can see that redness on the front of the eyes. So the omega-3s help to reduce that redness. When it comes to inflammation, they found that krill oil did better than the others. They measured the amount of a pro-inflammatory molecule called interleukin-17A. That's a cytokine, a protein that's involved in inflammation. Interleukin-17A will activate immune cells, which will then create inflammatory molecules, which will then recruit other immune cells to the site of infection or inflammation or damage. It's often associated with autoimmune diseases like rheumatoid arthritis and psoriasis. And it's a great measure for dry eye disease because of the inflammation in the tear film. And they found that with krill oil, it was very reduced. If you're suffering from dry eye disease, then I do recommend an omega-3 supplement. Now, there is some concern about contamination, whether it be mercury or microplastics, and I do think that's a valid concern. Wherever you're going for your omega-3 supplements, make sure it's a reputable company and that it's third-party tested. You could go to the algae-based omega-3s. That would avoid most of the possibility of toxins. That's definitely the choice for anyone who's vegan or vegetarian. Algae-based is a triglyceride-based omega-3, so similar to the fish oil with that profile. I don't know of an algae-based versus krill oil study, but when I do, I'll post about that. In the meantime, any supplement that is high quality, that has those omega-3s, is going to be beneficial based on these studies for your dry eye disease. As far as the EPA to DHA ratio, about 2 to 1, it seems to be what most of the studies are looking at, and about 2,000 milligrams a day. So 1,000 milligrams at breakfast time, 1,000 milligrams dinner time. Too much of a good thing is bad. I wouldn't really go over 2,000. If you get up to 5,000 plus, you start to have some bleeding issues, potentially some blood sugar control issues. I just keep in that 2,000 milligram range. So in conclusion, consider taking an omega-3 for your dry eye disease. Krill oil in this study kind of edged out the competition. I personally kind of like the algae oil best, but something of good quality should be helpful for you. If this was helpful to you, consider subscribing, and I'll try to continue to post different studies and data on how to help with dry eye disease. And if you have any questions or concerns, then put it in the comment section below.